Welcome back to today's video session. Today I'm going to show you female catheterization. So female catheterization is insertion of a plastic tube into the bladder through the urethral orifice. And catheterization may have different indications. The first may be urine retention as preoperative care as well as to take sample. So to begin with, here are equipment necessary for female catheterizations. Here is the sterile field and here is also the clean field. Within the sterile field, we need different equipment. The first one is, here is a fenestrator towel. Here is a fenestrator towel. Here is a round dish. Here is a kidney dish. Here are different forceps, dressing forceps. At least three dressing forceps are needed. Here is appropriate size female catheter. Here is a syringe, and here is also a gauze. Here is a gauze. Under the clean part, we need a clean glove, packed sterile surgical glove, rubber sheet, draw sheet, as well as iodine solution. Here is a receptacle or dustbin and safety box, as well as two vases, one containing solution, the other containing dry washing towel. So, having this, we will proceed to our procedure. So, before starting any procedure, we have to explain the procedure to the patient. So, Ms. Almaz, I'm Mahmoud, working in this hospital. I'm going to help you, and as you know, you have a urine retention. So I need to insert a plastic tube into the bladder of the ureter to remove the retained urine. Are you agree with this? Okay, she's already agreed. After that, we have to check for order catheterization as well as name and bedside will be checked. So this is the right person, the right individual for catheterization. After that, before touching a patient, we have to wear a clean glove. Wear a clean glove. Next, we have to position the patient, use a screen to prevent unnecessary exposure, and he's also overhead light to enhance visualization of the urethral orifice. So, after that, we have to position the patient with reassuring. Ms. Almas, I'm going to position in dorsal recumbent position. So, please help me. So, this is the dorsal recumbent position. So here is a dorsal recumbent position. After that, we have to drape the patient using rubber sheet first. Next, draw sheet. Okay, here is a draw sheet. After that, we will provide perineal care. Here are equipment for perineal care. Here is a basin with soap solution. So we have to handle a washing towel like this. So soaking washing towel with soap and water. After that, cleaning the perineal region using different forms of the basin towel. After cleaning, we have to dry it. Using similar procedure with the first one, and don't forget to use different corners of the washing towel. After providing a perineal care, we have to remove the clean glove. After providing perineal care, we have to prepare iodine solution. Okay. Adding KY jelly on one gauze and preparing a plaster, at least 2 plasters. After that, wearing a surgical glove First, wear the right glove only.
Okay.
Wearing the right glove only, then prepare a solution for inflation of the catheter balloon. After that, wearing the left glove. Okay, next you have to drape the patient using fenestrator towel. Then clean the urethral region using cotton balls soaked with iodine solution. You have to use different cotton balls for different strokes. Then dry. Better to use another forceps for drying.
Yeah.
So after cleaning, bring the equipment toward the patient perineal region. After bringing, you have to lubricate the catheter tips with KY jelly, water soluble lubricant. Then check the catheter for patency. Look this. So the catheter is patent. Withdraw it. After that, healing the patient and reassure while you are inserting. And don't forget to hold. Miss Almas, I am going to insert the catheter. It may have some discomfort. Take a deep breath. Then I will slowly insert the catheter. And observe the patient's face for any reaction. When the urine comes, put the end within the 1 kidney dish. Then advance it forward slightly. After that, inflate the balloon. After inflating the balloon, retract it backward slightly to fit snake on the urethral sphincter and observe for patient reaction. After that, remove the fenestrate. After that, clamp one end of the catheter with clamper. Then remove the used fenestrator towel. Attach the urine pad on the bed frame. Then connect the catheter with the urine bag. Attach it also on the patient thigh. Remove used equipment from the patient side. Remove used drawer sheet and rubber sheet. Reposition the patient. Tell the patient when you feel Miss Almaz, I'm already finished the catheterization procedure. Do you feel any discomfort? If the patient report anything, you have to respond well. After repositioning the patient, remove used glove. Wash your hand. Then document what you have done. When you are documenting, you have to document the type of catheter, date, indication, as well as any patient reaction, and catheter size also should be documented. So after removing all equipment from the patient side, including bed screen, I have already finished today's female catheterization procedure. I will come back with another nursing procedure. For the time being, don't forget to share, subscribe our channels for your friends. Thank you.